Over 50% of women diagnosed with cancer have demonstrated symptoms of anxiety and depression in the healthcare environment. Despite this high prevalence, clinical depression and anxiety are frequently overlooked by medical professionals as reports on mental health in cancer populations are rife with methodological inconsistencies. Within the hospital environment today, there are no clear and established national guidelines for screening or treating depression or anxiety. A lack of funding in specifically ovarian cancer research has led to a gap in treatment and support options for those diagnosed, as well as little knowledge regarding the nature of patient experiences or how to address the emotional challenges they face while undergoing treatment. A longitudinal prospective study was conducted to find the correlational relationship between the stages of ovarian cancer treatment and depression and anxiety levels. The sample consisted of 106 patients at the Medical University of Gdańsk in Poland. Researchers used 2 different questionnaires to measure anxiety and depression levels at 4 different time periods. The first prior to surgery and the following 3 during adjuvant chemotherapy. Anxiety symptoms were reported by almost 50% of patients prior to surgery, with this number dropping to approximately 18% in the following 3 time points. This shows a clear correlation between anxiety and upcoming surgery and presents an area of concern to be targeted by healthcare professionals as patients deal with the present effects of surgery on their quality of life and future effects of treatment such as infertility and early menopause. Depression levels remained relatively constant in about 10% of the sample, demonstrating the need for mental health resources specifically targeting this vulnerable population. In addition, clinicians need to be aware of the commonality of these 2 psychological disorders so they can be on their guard to better assess and treat the needs of their ovarian cancer patients.